I'm Dr. Yu. I'm a clinician here at Blower Pain Specialists. Today we're going to be talking about various pain conditions and various exercises that you can do at home to alleviate that pain.
What is the QL muscle? Why is it causing me lower back pain?
Maybe you've heard the QL muscle talk to you about with your physiotherapists, your chiropractors, your massage therapists, or in sports world or in injury world where you've hurt your back. The Quadratus Lumborum muscle, which is the QL muscle, it comes from here to here. It's an attachment on both sides, and it's pretty deep. It's a deep muscle that attaches to your hip or your ilium on both sides, or your ilia for one side, and attaches along here, and it can cause pain, especially if you have prolonged positions of sitting, standing, or even overuse if you're in construction or a heavy labor job like a nurse.
The QL muscle is a muscle that is constantly being activated throughout the day. Whether you're walking, standing, bending and twisting, it's trying to stabilize your spine so that there's not going to be too much excessive movement going through your lower back.
And what it's most responsible for are two actions, one of them being lateral flexion, so bending away from a certain area, and the other one being extension, so bending backwards.
Think about your spine as a small sapling of a tree, and beside it you have those safety wires to help it from falling over. Sometimes, if there isn't enough support all around using your core, as there's various muscles to help support the QL, they can become overworked and tight and may become hypertonic is what we call. This may then reduce the amount of motion, may cause you pain, especially in the low back when you're bending over, turning to the side, or even just breathing sometimes.
So pain in the QL muscle typically occurs when there's a lack of endurance or a lack of strength in the QL muscle. When we talk about the core, if there's weaknesses in other aspects of your core, that muscle sometimes have to overcompensate, and overcompensating repetitively over a long period of time just causes stiffness, tension, and pain directly in that region.
So usually the way that that muscle is aggravated is with a quick movement of flexion and rotation where the muscle kind of spasms and pulls on each other, and then it becomes locked up and tight. So it's really important that to understand the difference between a muscular pain from the QL or a joint pain that's coming from the spine.
Thank you for watching today's video. Please don't forget to like, comment, and subscribe. And for any questions about your healthcare, please contact our clinic directly.